I am thrilled to be here. Thank you so much, Dr. Peterson. And I agree that was a very engaging conversation with Dr. Hotez. I've seen him speak many times. And every time I learn something and feel more inspired. And I know that our audience is going to be similarly inspired by our next conversation, which is entitled Transcending Politics. And this is going to be a panel discussion with some wonderful speakers who I'm hoping will be able to introduce themselves. We have Dr. Brandt, Dr. Boyd, and Dr. Nwila. So I'm trying to see if on my view I can see your faces at least, but I would love, there you are, fantastic. I would love for you all to introduce yourselves. Why don't we start, we'll just kind of go alphabetically. So I think that means you're first, Dr. Boyd.
Thank you. Delighted to be here, first of all. Second of all, my name is Wes Boyd. I am a psychiatrist. I'm currently at the VA. I run the substance disorder treatment program and also the ethics consult service. I'm on faculty at Baylor College of Medicine in both psychiatry and in medical ethics and health policy. And I've been doing a lot of work, as you'll hear, in the human rights arena generally, and quite specifically with immigrants and asylum seekers for a number of years now. But again, very happy to be here. Thank you.
Thank you so much. Dr. Brandt?
And I have so enjoyed all these conversations this morning, so thank you again for inviting me. So I have had many, many years at Baylor. I am recently retired as a pediatric surgeon, but I went back to graduate school to get a Master of Divinity degree, and that primarily came out of a lot of my work in wellness as a program director and dean of student affairs and a lot of other roles, where I realized there was this big gap in vocabulary and understanding about what we were really experiencing. And I know I was very touched by Susan Rain saying that, taking care of each other is actually one of the key things that we need to do to rebuild what we're going through. And so that's really this next part of my career is trying to really work deeply in that area.
And I can attest, Dr. Brandt, to your knowing that wellness was important before I feel like it hit a national stage. I mean, I can remember you had a treadmill in your office, and I remember thinking that was amazing as Dean of Student Affairs. Dr. Nwila.
Oh, thank you so much, Stacy. It's great to be here with everybody. Stacy, it's great to be here with you. Stacy and I were residents together, which is kind of a testament to how long I've been around, because I have been like inbred here at Baylor, meaning that student, internship, residency, and now faculty for X years as
internal medicine. May I interrupt you and just say, and we're so lucky, but keep going now.
We are so, no, thank you. And we're so lucky to have people like you still in around. I just love that all the names that we're here with. So I'm also in internal medicine faculty, hospitalist at Ben Taub Hospital. I direct also the program, the Humanities Expression and Arts Lab, which is under Dr. Krisner's special office. And I'm also an author of the book, The People's Hospital, Hope and Peril in American Medicine, which was published last year. And it interweaves the stories of 5 patients that I encountered at Ben Taub, also with the history of private health insurance, how we got to how private health insurance is the entry point into American healthcare, how hospitals became for-profit versus nonprofit, and also the history of fee-for-service and how that became the dominant economic model. All of that to make an argument in favor of public healthcare. And I'm just very happy to be invited to this today. Thank you.
Well, again, I'm really excited to speak with each of you, and I'll go ahead and start with our first question, which will hopefully invite some opportunity for personal reflection. I know each of you are is a deeply reflective person. So just the title of this session, Transcending Politics, I think took each of us a moment to kind of wrap our heads around. And so I'd like each of you to maybe comment on, what does transcending politics mean to you? So maybe we'll sort of start in reverse order. Dr. Douila, do you mind taking a
Sure,
stab?
absolutely. Yeah, the title "Transcending Politics" gave me a bit of pause at the beginning, because I think if in our everyday life, it's hard to see that you transcend politics when so many of the barriers that patients deal with are policy related, and it might be the case that you can live where you're not as touched by that, but when you are confronted with people who really have that as a barrier, the word transcend just seems to make me bristle slightly. But then, I think that for me, the other part of the way I look at things kicks in, which is the creative writing side, which really seeks to, I think what creative writing does for me is that it helps me look deeper into the people that I'm with, and look at the reasons underlying how they behave, how they think. It's ultimately a tool for empathy, and I feel that that is really, really powerful and helpful in trying to connect with people who might not have the same politics with you, and also inform what you might be your own blind spots. I'm not saying that you negate some of the things that you've built, the philosophical ideas, the ideologies that you've constructed over the years, like your beliefs, but they inform them. These conversations, this deep empathy, and speaking with people about their different viewpoints and situating that, contextualizing that in your mind, kind of gives this different angle that you might not have seen before. And so to me, transcending politics, that's what it means. It means beyond ideologies, really looking at human beings and seeing that human beings are all infinitely complex. And some people have different ideologies, different ideas than you because of their humanity. And I think that transcending politics, that's where I take it when I'm on the wards, and when I am with either colleagues or patients who have very, very different political ideas, because I like to have these conversations. I look to see, how do we get beyond what is, what might be broadcast politically, what is the human connection, and then how does that human connection inform my own ideas about the topic?
What a beautifully articulated answer from a very articulate colleague and friend. I love that. I love that thought about, using creativity as a way to build bridges instead of only focus on the barriers, not to discount the barriers. I guess, Dr. Boyd, would you like to go next?
Sure. For me, I agree with a lot of what Ricardo said. The fact is, we can't get away from the fact that we live in political environments, and our patients also live in political environments, and wholeheartedly agree that so much of what our patients come up against and what constraints they experience when they're trying to access healthcare, for example, that comes right from political environments. I've worked a lot with in the arena of trying to promote access to mental health care, for example, and there's so many both political hurdles and insurance hurdles that get in the way of people being able to access health insurance or mental health care when they need it. And then, as I said in my intro, I've worked with asylum seekers at this point almost for 2 decades. And asylum, when I got into it, it was really because I just worked in a safety net hospital with a large immigrant population. I had students coming to me saying, I want to do some work with asylum seekers. And so I just got into the work sort of organically without even appreciating at the time that it was such a hot button political issue. And I've been doing this long enough. Everyone knows that under the Trump administration, asylum was put front and center, but I've been working in this arena long enough that things were absolutely awful for immigrants generally and asylum seekers in particular. in the Obama administration. They didn't get any better in the Trump administration, and they're still really, difficult, if not awful, currently. So much of the work I've done has been against this political backdrop. And the way I, sort of think about transcending politics is I focus, and Ricardo said as much in so many words, I focus on the person in front of me. I try to do the best I can, blocking out all of the political rhetoric, which most people on the call might not, or on this Zoom might not even realize that seeking asylum is fully legal according to both US and international law. But given the rhetoric that you hear politically and in the media, most folks would never even know that. So I really focus on sort of first principles, what's right, what ought to be a human right. And in fact, the UN and the Universal Declaration of Human Rights actually says seeking asylum is a fundamental human right. So I just really stick with first principles, like what's right and wrong. I have my own sort of moral compass. I really have to block out a lot of what's going on around me when I'm sitting across from someone whose life literally hangs in the balance, whether or not they're going to get asylum and not be forced to go back to their home country.
Wow, I can only imagine what experiences you've had over the years, and how, deeply those have impacted, of course, the person on the other side of that conversation, but I'm sure for you as well. So.
Yeah, in Transcending Politics, I gave a talk in rural Pennsylvania a few years ago at a university. And it was on asylum and immigration. And there were armed guards at the back of the auditorium. And the university president only told me at the end of my talk, because they had advertised it publicly ahead of time, only told me at the end, oh yeah, well, we got a few death threats and other threats like that. That's why the security was in the back. And I had no idea until the end of the talk. But so even though for me, it really is apolitical, I want to do my best to help individuals. You can't get away from the fact that there's this larger environment around us.
Very helpful lens. Dr. Brandt?
So, in thinking about this, I'm kind of a word nerd, probably not as much as Ricardo, but I really had to kind of go back and think about, when we talk about transcending politics, well, what exactly do we mean when we say politics? And what does the word transcend mean? And since I just graduated from seminary like 3 years ago, I went a totally different direction with that. But I looked around, and my favorite definition so far for politics is from Harold Lasswell, who's a political scientist. He defines politics as who gets what, when, and how. And I thought, that's perfect, right? Because I think part of the issue that we're going to come around to is that a lot of this we avoid, we don't name it, we somehow are scared of entering politics, except for Peter Artels. And so I think there's something about understanding fundamentally that what we're talking about, who gets what, when, and how. And then transcend is actually a really interesting word, because trans means above or beyond, but scandere, the other part of the root, means to climb. And so it's basically to climb over something that's in your way. And so I really think some of this is about climbing across a barrier. Once we begin to recognize who gets what, when, and how, and where the problems are with that. And I totally agree with Wes. It's really about your moral compass and tackling this and figuring out, how did we ever get to a place in the United States where we ever see anyone's as not worthy of healthcare? I mean, when you stand back and ask that kind of fundamental question, that is a political question, right? Who gets what, when, and how? I will disagree with Ricardo that first of all, I totally agree it's about the person in front of you. That's who we are as healers, right? But I think Ricardo's a really good example of climbing over those barriers by naming them and talking about them. And if you haven't read his book, you really need to. It's really kind of entering the fray of this and defining in a way that people can hear, how did we get here? And what are we talking about when we talk about healing other human beings, and somehow limiting that to a big part of our country in ways that it's very hard to get beyond.
Yeah, I love that you went to the word definitions, and it really does help you sort of put things into bigger pictures. I wonder, you mentioned a moral compass. Dr. Boyd mentioned a moral compass. People talk a lot about this concept of moral distress and impact that can have on well-being. And I'll start with you, Dr. Brandt, just, given that your background and even in your introduction, you talked about how important that concept of taking care of self and our colleagues has been in terms of promoting what's right and best care for our patients. So I guess my question is, given environments that are often politically charged, how do you prioritize or ensure a continued sense of fulfillment in what you do?
Well, so there's a lot to unpack there, right? So moral compass.
Yeah, sorry. No easy questions in this session. Yeah,
No,
disclaimer.
because I do really think the moral compass is fundamental, and I think we all understand what we mean by that, but I also think we need to take the time for ourselves to really articulate, what are our guiding principles when we're working as healers. Where are those lines that we can go up to them? We certainly want to work with people, compromise. I loved Dr. Girard's comment about sometimes you have to be just willing to take 80% because that's what you need to move the needle. And I get that, but sometimes it's no, I can't go there. I have taught a lot of people my trick for this, which over the years, I basically came up with 3 rules for myself that kind of define my moral compass. And then there's a few corollaries, but rule number 1 is always do what's right for the patient. Rule 2 is look cool doing it. And rule 3 is don't hurt anything that has a name. Now, I'm a surgeon, but rule 1, don't do what's right for the patient, has no exceptions, right? That is the guiding rule. And so you have to get as close to that as you can and push back against situations that don't let you. Look cool doing it is obviously technically as a surgeon or whatever you do, you have to master your professional art, but it's also don't lose your cool. It's the professionalism part. Mm-hmm. It's how kind we are to each other, how we take care of each other. And don't hurt anything that has a name. I mean, if you're a surgeon, you don't want to cut the ureter if you're taking out the colon. But you also have a name, and your spouse has a name, and your partners at work have names. And so it's really kind of an edict to take care of each other. So that's kind of the first thing I would say is it's very, very helpful, I think, to whether it's love your neighbor as yourself, however you articulate your moral compass, that you actually take some time and think about that for sure. And the other part, moral distress, I simply will name it and say what it is, because I think a lot of people really understand the angst of it, but they don't understand exactly what it is. And moral distress is knowing the right thing to do, but being in a system that doesn't let you do it. And that's basically it in a nutshell.
Thank you for that clarification, and what a simple but impactful message, right? That we need to sort of reflect on what is that grounding set of principles so that we can understand how to do the right thing. Let's see. We'll just kind of go in reverse order this time. Dr. Boyd?
Well, that's hard to follow, to put it mildly. But I am really happy to be on the panel, even though it's intimidating to be with these folks. But
yeah, but we all had to follow Peter Hotez.
Okay, touche. How do I prioritize joy and fulfillment? I do it several ways. First of all, I like helping people. I came from a disadvantaged background. Neither of my parents finished college. My 2 oldest siblings barely finished high school. So I sort of remind myself regularly that where I'm living and what I'm able to do now is pretty remarkable, given where I came from. And I feel like if I can help folks who have historically not had a voice, or who've been overlooked, or who are being told, stay out or stay away, anything I can do to empower them and help give them a voice, not speak for them, but empower them, that gives me joy. And so I remind myself just basically, what am I doing in my work, first of all. Second of all, I generally do a lot of teaching. Almost every single evaluation I do of an asylum seeker is with several students. And so even though I've done literally hundreds of evaluations of asylum seekers personally at this point, doing it with someone who it's their first or second time, walking them through the process, preparing them for the pain they're going to hear, debriefing after we meet with the client, and then writing the best report we can to help someone get asylum. Again, overwhelmingly, folks are facing death if they're forced to go back to their country. So, I just think, okay, this is what I can do with the skills I have, the education I have, et cetera. And so not just teaching students, but writing about it, speaking about it, doing anything I can to promote awareness about it. All of that actually gives me joy. And then again, just feeling like I have to stay on the side of what's right. I need to, block out any of the sort of background noise, the political rhetoric, whatever, and focus on the job at hand. I mean, that's what really gives me joy and fulfillment in doing the work I do.
I love that. And one of the things that made me think of was, they talk a little bit in the business world about celebrating the wins. It's almost like if you only focus on sort of this tidal wave of challenges that sometimes you can feel quite overwhelmed, but you're able to find fulfillment and joy knowing that you have impacted this person that's in front of you, kind of coming back to that humanity, or the learner who's in front of you, and empowering them to help another generation of needy individuals.
And you just reminded me of one other thing I wanted to say. I work pretty closely with the Boston University Immigration Clinic. I did over a dozen cases with them, very tight with the woman who runs the clinic. And we talked a lot about, where do you get joy? How do you take care of yourself? And she said, we celebrate the wins. Anytime my clinic, gets someone who has a client who actually has been granted asylum, we have a ritual the next day. We go around, we celebrate, you name it. So absolutely, when you're on the winning side, you've got to really pause and appreciate that.
Beautiful. Dr. Newella?
Yeah, I really love that concept of celebrating the wins, and I feel like on my good days, I'm able to kind of take a step back and see what a win is. Sometimes we can just the daily flow can obfuscate what a win is, and not really not have you appreciate what is actually happening, which is that sometimes these wins can just be hidden, so I really love like putting yourself in a position to appreciate that. And I feel that I love that the term moral compass came up. I feel like it's essentially connected to distress. I think that I feel very comfortable with my work because I feel like the moral compass is right where I work. I don't know. I mean, it's been a deliberate choice. It's been one of those things that has that created in me at the very beginning a kind of a stress to be a doctor. I did not, when I was going into medicine, I did not know if I could work in a system that felt so unjust. What I learned is that there's ways that you can make it so that abides by your moral compass. You can look for that, and if you follow that moral compass, there's such nuance. There's so many different ways to find things, and I'm just thankful that I found a place like Harris Health and Bentab Hospital that I think allows me to work following that moral compass. It's not perfect, and I think that is part of transcending politics, is that there's no policy that's ever been written that's perfect, just as there's no human being that's perfect. but it's workable enough, and it has these fundaments, this mission that abides by moral compass. And so I feel like that is essential for my avoidance of burnout and for avoiding distress. I feel like that there's that a lot of the daily grind, take away medicine, but a lot of the daily grind that we find in our lives, a lot of that friction is moral friction. I think that we are all aware that, oh gosh, if I use another like bottled water, does that add to the environment? I think we're intellectual enough to know that our actions have consequences, and yet we're in the system where we feel ourselves like we can't do anything about it. So that's one of the reasons why celebrating the victories is so important. I think it's because it's essential to counterbalance that feeling of being in everyday life and feeling like that you can that you're in this world where every decision is weighing in some way against somebody else. But I also feel like you have to kind of look at that compass and see where is your path headed for it, because it's hard to that compass could go in many directions, but it's your path that's so important. And I just feel very fortunate that mine is leading toward something like that aligns with a lot of the values that I have: public health care, helping people who are otherwise not heard, just feeling on a daily basis that people feel understood. So, I mean, I just feel like it's essential, like the moral compass is essential to avoiding the distress.
I mean, certainly couldn't have said it better. And it actually was interesting the way you sort of are tying together some of the concepts that Dr. Boyd and Dr. Brand have mentioned as part of their responses earlier, things like, drilling down to making sure what your principles are, because it's going to be better. You're going to be more equipped to be able to align your career choices with that meaning if you have an understanding. And so actually that kind of leads into what may end up being our final question, depending on our time. I would like to invite the audience also to please type into the chat if there are questions you would like to ask of the panelists. But I think transitioning a little bit to academics, so all of us, at least in some degree, are on the academic side of medicine. And what I want to ask, especially kind of piggybacking off of Dr. Nwila's comment about making choices, right? We have many choices in academic medicine. There's plenty of politics in academic medicine too, and it's not necessarily the red and the blue, but I think we would all use that definition that Mary gave us at the beginning. So my question is, what suggestions might you offer to sort of the next generation of leaders in academic medicine when it comes to the choices they should make to both enhance their joy and meaning and use their platforms responsibly for social justice or social change? It's kind of a loaded question. I know that's a big one. So I'll just rephrase it. So as we're thinking about academic medicine and transcending politics in academic medicine, what suggestions do you have for the next generation of leaders to both enhance their joy and fulfillment in what they do, and also make choices that can allow them to use their platforms for social betterment? And I'll open this one up to any of you can answer first, because it's a toughie.
Well, I'll go first, and a comment. First of all, I think we're heading for, if not a meltdown, a major transformational time in medicine. There's just no question. I'm very struck by the fact that marketization of medicine. So the first realization, or the first big movement that said we can make money on medicine by putting it in the market, was 40 years ago, which is when I graduated from Baylor. So in my lifetime, we've gone from marketization to corporatization so now the big corporate models and all the mergers, to private equity, which is now, I think, probably the financial part that's crossed a line for a lot of people, because there's just no connection between the patient and the mission of the place, with people that are simply turning over hospitals and practices to make money for a private equity firm. And I bring all that up because the more I've studied this and thought about it, and written about it, I believe the core problem with burnout and distress for healers is the moral distress that comes from working in a system that puts profit in front of people and patients and all of us who are practicing in that system. That's kind of the hard message, but I think the good message is that the upcoming generation gets this and is not buying into the same narrative that we were essentially colonized with. And that's kind of a loaded term. But colonization is not just big, rich countries taking over other countries. It's a dominant thought. It's you have to accept what the principles are. And this principle of more, and more profit is, I think, what's driving a lot of this. And I think it's going to melt down. But I'm encouraged for the new generation. I think they get this. I think they're going to have to name that. I think they're going to have to confront it head on. And I think they will.
Wow. I'm speechless, which doesn't happen very often, as those of you who know me. That's really, it sort of makes me both nervous and excited to see what's on the horizon. So, others?
Well, I'll chime in. I agree with what Dr. Brandt said, which is very common, and one of the reasons why I feel very good about having gone to Baylor. If I was going to give advice to administrators about the next generation, it's to look, and this is going to sound abstract, but to look at what the debate that sprung this past summer from the Writers Guild and the Screen Actors Guild. The central debate that came out was what is art? What is art? Is art human, or is it something else? Can a machine create art? I think that was a very essential question for our society, and it's an essential question for medicine too, because I think that we're going to feel not only the pressures that Dr. Brandt described, which are ongoing and their private equity, which is the relinquishing how care is to the market, to a market of people who are blind to this mission, but it's also to machinery to come up with the definition of what is care. Now, I believe that medicine is human at its core. I think people want a lot of things. Patients want a lot of things, but I think that at its very essence, it's a human being providing that care. Yeah, the human being will utilize tools to give that care. Many of them which are technologically based, but I think it's essentially human, and there's a level of responsibility that the other human being who's providing that care can give that no machine, no program can give, and that is fundamental to it. So I would say to administrators, think about that. Is medicine fundamentally human? And how do we derive education? How do we derive experiences to enhance the humanity of the people who are providing that care?
Amazing.
Yeah,
what a guiding light. Go ahead. Sorry, please go ahead, Dr. Boyd.
That's all right. No, I really like everything that's been said. And, whether it's private equity that is driving this demand for increased productivity in clinicians, or just administrators who don't know what it's like to sit with patients, the demand for ever increasing productivity, which I've seen in my career, It's relentless and it takes its toll. And it really de-emphasizes the, human connection between doctors and patients, which is what most of us go into medicine wanting. That's what makes us idealistic. And then we've got people above us for whatever set of reasons saying, no, just churn out the RVUs, right? I, for over a decade, ran the clinician health committee at my previous hospital in Boston, and we had at one point 6 hours altogether of town hall meetings with everyone in the hospital, mostly in the mental health department, but across the hospital. Overwhelmingly, what clinicians and everyone else wanted was open communication, as much as possible from leadership, and as much control over their ability to see patients how they want as possible. And the market-driven medicine environment that we live in really militates against both of those things, like actively makes it difficult. And then you also had a question about advocacy. And I thought a lot about the question about whether or not doctors ought to be advocates in general and or on behalf of their patients. For me, personally, I don't have any choice in the matter. It was done for whatever set of reasons that's in my blood, and I can't help it. But I do wonder about the question, maybe put this out for everybody, is it an obligation of physicians to be advocates in some way or other? I asked the question, and I'm mixed on my own answer because my wife's a pathologist. And she's one of the best in the country in her field, but I don't know that it would make sense for her to enter the advocacy arena, at least as I define it, or the neurosurgeon who's operated on me 3 different times now. He's technically maybe one of the best in the country, but I don't know that I need to see him out, on the front lines advocating in the ways I might be doing. So my jury is actually mixed on that question.
Well, and we have a few questions from the audience, and one of those sort of touches on that question. And so I'll read it. Appreciate the wonderful frames on politics and our role as healers. What a great group. So compliment to the speakers. But the question is, how do you balance the sense of justice for our patients, right and wrong, with the toxicity of today's politics and with this idea that politics can be the vehicle for addressing injustice or contributing to greater injustice? How do we understand our role as physicians and healers in the midst of these tensions? I mean, to me, I was kind of reading between the lines there of, to what extent should we be connecting with politics, so to speak, or with, organizations, policies to be drivers of change, as opposed to sort of an individual lens on how we're framing our own moral compass in connection to what's going on around us. And it sounds like Wes is already knows he's mixed on his response. So do you guys think that physicians should be jumping into advocacy?
So we are advocates in our blood. It's part of what we do, right? If we want what's best for the person in front of us, we have to advocate by educating them. We have to advocate by pushing back when we can't get things for them. And that happens almost automatically in almost every healing situation I've ever seen. I think the question, it's not an either or. It's just a matter of how big the circle is that you feel called to as an advocate.
And
so,
that framing.
So for Peter Hotez, it's like the world. And I think for, my circle right now is very much about healing healers, and advocating for that. And so I think at different points in our career, different issues arise and we move in and out of those spheres. So I don't think it's as binary. We all tend to think of everything as kind of binary,
yeah.
But I think it's really very fluid, and we're all of it at different points.
Yeah.
I love how that Wes feels that tension in that question, because I feel like if one really looks at the question, one ought to want to feel that tension. Should I be an advocate? Should I not? And the way that I see it is that, I think that it depends on your idea of what advocacy constitutes. Like, I agree with you that it might not be the best scenario where like a pathologist is on the stage, but that's just one form of advocacy, you know? And I tend to see advocacy more in lines like service, you know? Do I serve this person in front of me? That to me is like the deepest advocacy that I have. And in that context of what it means to serve that patient or that colleague even, or whatever we want, that relationship in medicine, different responsibilities come up and what it means to serve. But I want to feel like I have served that person well, and that it is, and I feel like then if that's the case, then we can all be advocates, and we probably need more advocacy overall, because I think that it just so happens that one of the allure in this country is toward this individualism, but I feel like service is a counterbalance to that. Service toward others helps us, gain so much more and help bring these subjects to a higher, level, so that everybody can enjoy them. So
yeah,
that's how I feel.
I like both of those responses a lot. Broadening the meaning of what advocacy is beyond, getting out on some political stage. It's like, if I'm providing the best treatment, offering the best diagnosis, working toward just healthcare with this individual patient or this individual, specimen that's come, through my lab, then I am an advocate in those ways. No, I really like that a lot.
Well, I think it's very clear that you all are consummate professionals and advocates and healers and scholars. And I just hope that you, as individuals, will continue telling your stories and inspiring generations of folks to follow in those paths. And I guess just as a final comment, I really appreciate that concept of humanity and really serving the person in front of you, and that our own ability to derive meaning and fulfillment from that hopefully will help us climb over the politics of our time. Either climb over or just break through them, whatever is the right situation for that moment. Well, thank you again. I want to remind everyone we're going to take a short break from 12 to 12:20 for lunch, and then I hope you will join us at 12:20 for what will really be an incredible keynote speaker, Dr. Robert Blendon, moderated by Dr. Ellen Friedman, our Center for Professionalism Director. So thank you so much, and I will see you at 12:20.